Hi, Manchu resident. This is Dr. Komal Gangar from UMS Family Medicine Residency in Little Rock. I'm a PGY1 and I completed a month of residency. So I'm here to share my thoughts about how I felt about the transition into residency. Where to begin? So, my program kind of had a really good long orientation. We started early in June, 20 June. So since then, we have had so many meet and greets, fun faculty events, team building exercises. We had, I think, at least 3 welcome parties. We had a bunch of lunches with the chief, and we had so many informative lectures, and in hindsight now, they are important. Everything they taught us in those lectures comes in handy now that we have started clinics and work and rotations and are in our own practice. So yeah, it's those lectures were very it felt boring, but they were very useful. So for example, billing and coding, or HPI, or epic training, or so many. Like there was one about behavioral health, there were few about prescribed drug monitoring program and how do you navigate that. There were and I think throughout the course of residency we will continue getting the lectures. We're a batch of 6, so most of us are like without family. It's just we became our own family, so that's been great. All of us, me and my co-residents, we became like a team, like actually a team, both personally and professionally. So we often hang out after work, before work. That's a great support to have, and a great set of friends that I can actually truly rely on. And once I think we started transitioning into the clinical part about 2 weeks ago, we started seeing our own patients in the outpatient setting at the family medicine center. So we, as first year residents, have our own like 70 to 80 patient panel assigned to us, and over the course of 3 years we get to see more and more of those every day. So my first patient was like it was such a great feeling that I walked into the room, I introduced to them as I'm going to be your PCP, and they were so happy and excited to see me. And the best part of starting with so much orientation is we were kind of prepared for everything that could happen during our transition into clinical practice. So I think the program did a great job trying to prepare us for that beforehand as much as you can. I don't think you can ever be fully prepared. There are things that are not going to go your way, and you just deal with it. We have support of seniors and faculty, and you do feel like your medical knowledge is kind of not up to the mark sometimes, because there's textbook medicine, and then there's medicine you practice in the hospital, the clinical part. So it's not just that you know what symptoms the patient presents with or what drugs to give for those symptoms, but you also need to know if it's right for that patient. You know in the textbook that for this patient it's this medicine, but when you see that patient in front of you, to identify those symptoms that you read about and remember what the management is like is actually really fun. And there are times that you get it right, there are times that you get it wrong, but you're here to learn. I remember one of my mentors telling me that a good resident is a resident that's trainable. So as long as you're willing to train and you're willing to put in that effort to learn. So learning is like an ongoing process for any physician throughout their practice, but as residents it's more so. This is your time as 3 years to build your big chunk of knowledge base with a variety of experiences. So I'm very excited about that. Like, we were asked to share 5 things or 5 goals in our first year of residency, and I that made me think that what do I want out of these 5, out of this year, and it kind of made me more focused on my priorities, and not because it can be overwhelming. Honestly, like, there's so many things going on, so many different schedules, changes. You're supposed to be a student, a physician, a good, that's like the balance of being a good resident. Like, you have to be a physician, a trainable physician, and a good student. And I think even if it's overwhelming day to day, if I just show up to work and do my job to the best of my capacity for that day, there are going to be good days and bad days, I think I'll survive. It has also made me much more humble, I would say, looking at the patients and their problems and their chronic conditions, being able to connect with them, how they dealt with it, how they live with it, and kind of being able to take some of those learnings back into my daily life has been really rewarding. And I'm very there's so many different rotations that we've been put on already. Like, I'm starting with urology, so I go to the urology outpatient center, and then I do half a day there, and then half a day I come back to the clinic to see my own patients. And I think next I have 1 week of clinics and airway, where we learn intubations and 1 day surgery, so basic life supporting management. And I'm very excited about the wards month, which is going to be after that. Yeah, so the first week and the first month of residency has been as varied as it could be. Like, one morning we were in orientation learning about the bureaucracies of residency and the do's and don'ts of a hospital, like basic hand washing techniques, to that evening we were seeing our own patient. There was one morning where we went across campus to get our badge access, parking access, and that evening we had a lunch with our chiefs. So honestly, it was a very well planned and tailored orientation, and a great transition from the orientation to get everything set up, to get your Epic set up, your computer set up, to get your badge access, to actually walking into a patient's room and saying, "Hi, I'm your doctor, and this is what I planned for you." That's a huge transition to go to, coming straight out of research or med school, and then being a physician. This is truly like hopes and dreams coming true, and I'm very excited to learn, and I'll keep you posted about what happens next in this journey. Be sure to follow me on Komal_NIKU, that's KOMAL_NIKU, and I post a lot of stuff about day in my life as a resident. I'm here in my residence lounge. We have a really cool lounge, and our residence lounge has a massage chair. I guess I love my program.